Welcome back to my channel. If you are visiting my channel for the first time, you're also highly welcome. In this lecture, we'll be looking at the differences between the arteries and the veins. Let's look at the general configuration. Arteries generally are known to carry oxygenated blood away from the heart, while veins are known to carry deoxygenated blood towards the heart. Let's say this is the configuration of the heart. The blood that is oxygenated and is ready to be taken to the different body organs to supply them with oxygen will be taken by the artery, and it will be taking the blood that is oxygenated away from the heart. And that is why arteries generally are known to carry oxygenated blood away from the heart, so that the blood will be used to supply different organs in the body. Let's say this is the organ highlighted in white here. After the usage of the oxygen that is contained in the oxygenated blood, the remaining blood that is now left deoxygenated will be taken back into the heart vein, and this is the vein highlighted in blue. So the vein will then carry deoxygenated blood towards the heart. So we can see the differences. Arteries will carry oxygenated blood away from the heart to supply the different body organs, while veins will carry deoxygenated blood towards the heart. And there are exceptions to this, and these exceptions include the pulmonary arteries and the pulmonary veins. So we know that all arteries in the body carry oxygenated blood except the pulmonary artery, and also all veins in the body carry deoxygenated blood except the pulmonary vein. So this is where the exception is established. Let's look through these. Let's use this image down here. This is the pulmonary artery. The pulmonary artery will carry deoxygenated blood instead of the normal oxygenated blood. Pulmonary artery will carry the blood that is deoxygenated, and it is taking this blood to the lungs. This is the lungs highlighted in white, where it will be oxygenated. We know that in the lungs we have oxygen, and for it to carry blood to the lungs, the blood needs to be deoxygenated so that the oxygen will be taken up in the lungs. This is where this exception is established. In the lungs, after the oxygenation, the blood becomes oxygenated. This oxygenated blood is then taken back into the heart, and it is taken through the pulmonary vein. This is the pulmonary vein. This is one. We have four, two on the right and two on the left. So it will be taken up by the pulmonary veins, and the veins will then deliver the oxygenated blood into the left atrium. From the left atrium, it will be delivered into the left ventricle. From the left ventricle, the blood that is oxygenated will be emptied into the aorta. The aorta then delivers it to the different organs in the body. So that is why we say that this exception are so clearly established in the pulmonary artery and also the pulmonary vein, where the pulmonary artery is supposed to be carrying oxygenated blood, but it is carrying deoxygenated blood because it is taking this blood to the lungs where it will be oxygenated. Also, the pulmonary vein that is supposed to be carrying deoxygenated blood is now carrying oxygenated blood from the lungs to the heart. So in general, if you want to establish the differences between the arteries and the veins, we can say that the arteries carry blood away from the heart, while the veins carry blood towards the heart. And another difference would be that the arteries carry oxygenated blood except the pulmonary artery, which carries deoxygenated blood, and also the veins will carry deoxygenated blood except the pulmonary veins that carry oxygenated blood. So going further on the differences between the arteries and the veins, the blood in the arteries flow under high pressure, while the blood in the veins flow under low pressure. So taking this image also as illustration, we know that oxygenated blood is pumped from the left ventricle here into the aorta. This is the aorta. The pressure that the left ventricle exerts so as to be able to push the oxygenated blood into the aorta is high. And this pressure, of course, is transmitted to the other arteries in the body. So that is why the pressure in the artery is high when compared with the vein. Also to add that blood movement within the artery is seen to be very fast. So the rate of movement is fast because of the pressure that is imparted on the wall. While in the wall of the vein, the flow of blood seems to be slow because of the low pressure. Then another difference that I would want to highlight is the absence of valves in the artery. This is the artery highlighted in red. We say that the artery, the flow of blood is under high pressure. And because the flow of blood is under high pressure, the blood is already flowing in one single direction at high pressure. So there is no need for the creation of valve because valves are so created to allow the path of blood in one direction. But because the pressure in the artery is already high, the blood is already tailing towards one direction under high pressure. So there's no need for creation of valve. So there is absence of valves in the wall of the arteries. Why in the veins there is presence of valve? Because remember we established that in the veins we have low pressure. So the blood is moving at a very low pressure. Hence there will be creation of valve. So the valves will help push the part of blood in one direction. So there is the necessity of the creation of valve in the vein. Also to add that the volume of blood in the arteries is low, while the volume of blood in the veins is high. Because we say that in the artery, there is a high pressure created already. So the volume will be low. And in the veins, we already established that the pressure in the vein is low, so there will be high volume. So we have low volume in the arteries and we have high volume in the veins. So going further, talking about the walls of the arteries and the veins, this will enable us to be able to identify the differences between the arteries and veins, especially in our practical anatomy classes. When we see the vessels, we should be able to establish which is the artery and which is the vein. So talking about the walls of the arteries are thicker, they are more rigid, they are more elastic and also more muscular. So this is the wall of the artery highlighted in red. You can see that it appears to be thicker and more muscular compared with the vein. This is the wall of the vein highlighted in blue. The wall is thinner here. It is less rigid, it is less elastic and also less muscular. So if you look at the configuration of the circumference of the arteries and also the veins, you see that the wall of the veins are collapsed. Because the wall is thin and also less muscular, you see that they are collapsed. But if you look at the arteries, you see that the circumference is still well aligned because it is thick and also more muscular. The thickness and rigidity that is seen by the wall of the artery will help withstand the pressure. We already stated in our previous slide that within the artery we have high pressure, so it will help withstand the pressure and also prevent it from collapsing. More so, the thickness will help the artery to withstand what it is carrying. We know that in the artery, we have oxygenated blood and blood that is also rich in nutrients. So this will help support the artery to carry these substances. If you look at the wall of the vein, you see that it is collapsed, and it is collapsed because the wall is thin, it is less rigid, less elastic, and also less muscular. This can be used to differentiate the arteries and the veins in our dissection of practical anatomy classes. And also, if you look at the lumen of the artery, it is narrow. This is the artery highlighted in red. The lumen here is narrower than what is presented in the vein. This is the vein highlighted in blue. You can see that the lumen here is wider. And the narrow lumen of the artery can be used to justify its maintenance of high pressure, because we already said that in the wall of the artery, the blood flows under high pressure so that the high pressure will be maintained. So this is another basis onto which we can use to establish the differences between the arteries and also the veins. In the arteries, pulse can be detectable, while in the veins, pulse cannot be detectable. And this we can justify using this illustration. We already established that the blood is pushed from the left ventricle because this is where we have oxygenated blood that is ready to be taken to the different body organs, and it is released into the aorta. The pressure that it uses to drive the blood into the aorta tends to generate a form of impact, and this impact is transmitted and used to generate pulse. And this is also transmitted to the different subdivisions that emerge from the aorta, and that is why we are able to detect pulse in the arteries. We already established in our previous lecture that the wall of the left ventricle is thicker. As a matter of fact, it is the thickest among all the four chambers of the heart. So as it contracts, it generates intense pressure that it exerts on the wall of the aorta, and this is also further transmitted to the other arteries that emerge from the aorta. So that is used to generate pulse, and that is why pulse are detectable in the arteries. While in the veins, the impact that is created on the wall of the veins are not so much as what is created on the artery. The position of the arteries and the veins in the body are different. The arteries are usually positioned deeper within the body, while the veins are usually positioned more superficial. So we see the veins positioned more at the subcutaneous region, while the arteries are usually positioned deep to the body. This is to help prevent the damage of the arteries. We already established, if you try to flash back on some of the differences we highlighted between the arteries and the veins in terms of pressure, we said that the pressure in the artery is high and intense. And if the artery is located more superficial, it will be more prone to damage, and more quantity of blood will be lost during injury because of the high pressure within the artery. And in order to guide against this, the arteries will be positioned deep to the body, because if damage or injury occur on the artery, the rate at which blood will be lost will be more than what the veins will present, because the veins, the pressure is low, so it can afford to be located superficial. Because if damaged, the pressure is low, so the quantity of blood that will be lost from the vein will not be as much as when the arteries are located in the subcutaneous region. So thanks for watching. Let's meet again.